All right. I think we're live, Judge, so it's all on you.
All right. Well, welcome everybody. We'll go ahead and call this meeting to order. First of all, I just want to congratulate Amy. This will be her first official meeting, I guess, that's for the full board. We had a special call meeting with her already. Or I'm sorry, budget committee meeting, but congratulations, Amy. We're glad to have you taking the baton and hopefully leading us into green pastures, and we're excited about the next chapter of the district health board. So thank you for your willingness, and thank you, Sean, for your leadership to get us to this point. It's exciting times for the health department. So congratulations to you, Sean, for also being able to reach that milestone of retirement. So we'll go ahead and I'd like to open up, if you don't mind, with an invocation here. Just pray the Lord's blessing on us. So if you all just bow with me, please. Father God, we love you. We thank you for this time together, Lord, to conduct business for our counties, for our district, Lord. We just pray that you meet with us, give us your wisdom as we make difficult decisions, Lord, for the betterment of our citizens, Lord, for the health department, and for all of our people, Lord. We just pray that you give us your wisdom to make the right choices. Lord, just go with us now as we meet, and we just hope to honor you with our choices, Lord. We just ask this in Jesus' name. Amen. We do have a quorum. So the first item on our agenda will be the approval of our minutes from our previous, from our March meeting. So you all have received a copy of those minutes. Would I have a motion to approve those?
So moved, Judge. Mike Anderson.
I'll second.
That was Dr. Phillips that seconded.
Okay. Motion by Judge Anderson and a second by Dr. Phillips. Is there any further discussion? All in favor?
Aye.
Aye.
Likewise, any opposed? That motion carries. We also need to ratify our April and June special called meeting minutes. Basically, because of the time constraints of getting things done, we went ahead and submitted those minutes, but we do need to get a board ratification that everything was okay. So you all have got a copy of the April and June special called minutes. First, we'd entertain a motion to ratify the April minutes.
Make a motion. Jim Wesley.
I'll second Judge Cowan.
A motion and a second. Do we have any further discussion? All in favor?
Aye.
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 Is there any opposed? That motion carries, and likewise, we'll need to ratify the June special called meeting minutes.
Judge Kelly, my internet's going off and on here, so.
Okay, I'm not sure who said that. Was that Judge Craig?
That's
Yes, it
Judge
was.
Craig, yes.
I move to accept the minutes. That's Dr. Lee.
Patty Gwynn, I second.
We have a motion and a second. Do we have any further discussion? All in favor?
Aye.
Aye.
Is there any opposed? All right, motion carries. So we'll move on to old business, and I'll just ask the board here if there was anything that the administration failed to adequately follow up on from the last meeting. If you have anything that you would like to bring up, now's your time. And seeing nothing, we'll move on into resource stewardship. I'll turn it over to our new director, Amy Tomlinson, to talk about the financial stewardship or the resource stewardship.
Thank you, Judge. Let me begin. I guess on this agenda, it's financial updates and director comments. So if you will allow me just a moment to say thank you to you all for giving me the opportunity to serve in this capacity and to lead this wonderful agency and our staff members. I appreciate this opportunity and appreciate your all's confidence in me as a leader and in this agency. thank you for your support over the years. This past year certainly has been difficult for all of us, and don't know how we managed to get through it onto the other side, but we are very thankful we're emerging from the other side, and thankful to move on into bigger and better things now. So I want to talk to you all a little bit about this financial update. And this is our financial position as of May 31st. So almost completely through this past fiscal year, the current year that's about to end. So this is everything ending through May 31st. And I'm just going to do a quick summary for you all. These are very detailed reports that you all get in this packet. And I have spent the better part of a couple of days now looking over these and trying to familiarize myself with them and make sure that I'm telling you the appropriate things and talking to the right people. So I'm not going to pretend that you all don't know this stuff. You all have had a chance to review it, but I certainly want to answer any questions you have. I'm going to start on page 1 of this summary document. Basically, I just want to point out to you all that our current year-to-date revenues, this is what we have brought in year-to-date. So July 1 through May 31st, it's $13,700,000 and some change there. So 13.7 million. And then our year-to-date expenditures so far, as of ending May 31st, was 12 million. 0.8. So we're looking at a difference of roughly 913,000 as a surplus at this point. Now that is, as I said, not including the June numbers that are still coming in and they're going to be coming in. So we're actually, if you look at the final line on that document, the very final statement on there is saying that we expect to possibly end this fiscal year at as much as a $1.7 million surplus. So that is certainly impressive in this time and is sort of unique. You have to bear in mind that a lot of our budget and the things that you're going to see, these numbers are definitely skewed this year with COVID related funding. So it's one-time CARES funding or federal grant money that we may have received that may not continue on, but we have it this year. And there's some continuing things in the future that are going to, you'll see in the upcoming budget, but that's where we're at right now. We did not spend as much this past year as we had planned on some staffing issues. You know, due to COVID, we pulled staff in different directions. We didn't fill certain positions. We weren't allowed to do our hands home visiting to the same level as we had been in the past. So some of that is the cause for some of the decline in some of our revenues. Also, our travel costs, I think I may have mentioned some of that stuff was varied this year, not normally what we would see. We are also about 5 quarters behind on the Medicaid match payments that the state bills us for. So at some point, the state will ask us to make those matches. And that's a small part there that we would expect to pay back. That's about $375,000. So all that to say, our bottom line, as of now, we are at about $900,000, a little over $900,000 year-to-date surplus. And we actually expect to end at 1.7 million. The difference there is around, let's see, what, $800,000. A large chunk of that, maybe Mr. Crabtree can highlight that on the screen or move his cursor maybe to where it's at. He has actually control of the TV, of the monitors, but is because of local tax dollars that we haven't billed the districts for, the local counties for that final payment. And actually I spoke with Ron. He may want to chime in if he wants to contribute anything here, but I think we have those payments now, or the majority of those payments have been brought in since this report was ran, and that will reflect in the June updates. Is that correct, Ron? Are you available to talk?
That's 100% correct. As you guys know, we most of you know, we bill those. We cover all the payments on behalf of the 10 taxing districts, and then we bill them back for those twice a year. And the second half of that just came in June, about a week or so ago. Of course, this is through May, so you'll see that reflected when you see the June financials here in about a month or so.
Okay. So are there any questions on the year-to-date up to this point? There's a couple of charts on down. If you'll scroll down, Mr. Crabtree, the expenditures are outlined a little bit here differently in some pictures that may help you to see the actual. The blue is the actual and the red is the budgeted. So where there's a difference, primarily this year, everything is going to be chalked up to COVID. I know that's going to sound like a big blanket statement, but it has affected so many different programs for us and kind of skewed the numbers, as I've said. That's the pretty much the explanation across the board for most of these differences and things. You'll go ahead, Mr. Crabtree, just proceed on. I'm not going to go into a lot of detail on this. I just want to give you an overview on the statements of where we're at. This is just another accounting page that Ron has put together to show you the districts, the local tax contribution rates and the monies that's coming in there. Some of the revenues that we are expecting and that we do receive throughout the year. And you can see the bottom line there was also that $900,000 year to date. So. Many of these reports are just a different way to say the same thing. So I'm not gonna necessarily go over every single one of them. So Mr. Crabtree, if you don't care to just scroll. This one is a little interesting because it shows our patients, and you will see a significant decrease in some of our patient services and things that we offered this year. And again, I will say because of COVID, we had to primarily close down most of our clinic services. And so you can see the numbers there are definitely smaller than the prior year. We expect all of that to, at some point, bounce back this year and get back to a normal level for us. This is a trend chart that Mr. Crabtree has had them put together over the years that shows the patients and the services we've offered. You can see we are definitely trending down on clinic services and things that we have provided over the years, not just due to COVID. Of course, that's certainly the last year, but in general, our services have been declining due to other providers, coming into the area and doing that, and also due to increase in insurance availability for a lot of our patients who used to come to us with no insurance, and we provided services, and now they have a medical home. So they have a primary care place to go. This is the same information that's already been provided. It's just by cost center. So if you want to know, for instance, what was brought in on a certain program or anything, it's here by cost center. So you can look at that, what percentage over or under budget it was. A lot of detail here. So we're going to skip over a lot of this. And this is more of the same. It's just earned revenue, actual revenue, and the variances. So by cost center. This is very useful information, and it's stuff that I hope to dive into a little bit deeper as your director and as the person who's leading the agency. I'm going to sit down with Ron and kind of go over this, our finance administration officer, and talk about this more in depth. But it's definitely something the program managers are looking at and keeping up with and trying to see how their programs are coming in. They do this monthly. It's not something that we look at just once a year when we do plan and budget. This is something that they look at monthly, if not more often, and they kind of monitor their own programs and they know where they're at. More of the same.
This is
Okay,
the reserve calculation.
Yeah, this is our reserve numbers down here at the bottom of this page on page 17 of this document. And you can see that we are above the reserve amounts here. And we have been given by the state the last few years when we've had a surplus in our budget, we've been given a special dispensation, I guess, or a special allowance to put that budget or put that surplus toward our reserve in the intent of at some point paying down the liability we have on the retirement that's still hanging over our heads. So even though it's a large number here that we have, that's earmarked for the retirement payments that we know are coming. If you all have any questions at all on the year-to-date pieces here that where we're at financially at this moment, I'll be happy to try to address those, or we can bring in Ron or Mr. Crabtree as backups if I'm not familiar with what you're asking just yet.
And this last sheet, Amy, is just the modifications we've received for the year.
Those are modifications is anything that's come in that we didn't budget for, but was given to us or taken away from us at some point during the year. Are there any questions about the financial update? Okay. Judge, if it's okay with you, we'll roll on into the next item then, which is the presentation of the budget.
Okay, go ahead and lay it out.
Okay, so this is our fiscal year 22 budget. That's the one that will be starting July 1. And it is also a multi-page packet of information here that has a lot of detail to it. So I'm going to go over the summary with you, give you the high points, and point out the differences from what was currently done. As you all know, you've been around this long enough to know that the health department budget is pretty much a continuation budget. For the most part, especially this year, we haven't had a lot of restructure or any kind of reworking of staffing or anything programs. We are just trying to get back to what our normal was before COVID. So this budget is pretty much the same things that we've been offering the past few years at the same staffing levels, at the same everything. So it's very much what I would call a continuation budget. For fiscal year 22, this upcoming year, we are budgeting our revenues to increase by $1.8 million. So we're expecting to receive $1.8 million more this year than we did past year. There's a couple of reasons for that, and we'll get into that in just a second. But also on the flip side of that, our budgeted expenses are projected to increase by $1.9 million. So there's explanations coming on those numbers, but just want to get those out there for you so you kind of know where we're looking at. This budget that you're going to see is actually looking at ending next year, ending fiscal year 22 with a surplus, even after those increases in revenues and increases in expenditures, ending next year at a surplus of $1.5 million. So this budget was prepared with an increment for staff members factored in. But that is always something that's optional for you all. You can choose to do that. You can choose not to do that. But we always like to factor that in, especially with the year we've had with COVID. I think our staff are certainly deserving of that. Most people in this world are deserving of that. Let's just be honest. But the last 5 years, you'll see we have been able to give small increments 4 out of the 5 years to our staff. So we would love to be able to do that again if you also choose. We'll go on down, Mr. Crabtree, if you don't care, to the next page. And this is just it's very small numbers. I'm sorry for that, but you all have it in front of you, hopefully, or you've had a chance to review it. What I wanted you to see is the total receipts here. The total receipts for the budget year that we're looking at is $17.4 million. The total expenditures next year we're looking at is $15.9 million. So that does show you that difference there of what we expect to have as a surplus and be applied toward our reserve of $1.5 million next year. Now, the big differences on these numbers are going to be with state, federal grant, the state funding that they're going to be supplying. You'll see the number, the third line down there at the top, it's $2.4 million. And a lot of that, the next pages is going to go through this a little more detail, but a lot of that is due to the retirement structure that has been passed through the state legislature. So we're going to get into that in just a minute, but that's going to be a big increase there. And then HANds money, you'll see is another $1 million there. That is because we have not been able, as I said earlier, to do the HANds visiting and the HANds program at its capacity. So we expect to get that back to full capacity and be earning money there in that program. Okay, so this page gives you an explanation of some of those variances that I talked about earlier, and you'll see that state revenue that we're expecting to receive is primarily because of that House Bill 8. This is a subsidy that the state legislature passed for health departments to help with the retirement burden for the year. This is going to allow us, if we participate fully in their program, allow us to receive from the state a percentage of money for the next so many years. So next year it would be a 100% funding for the difference in what we would have to pay for retirement. And am I saying that correctly, Ron? The difference, it's the difference in the retirement that we would have had to pay.
Yeah, so I'm trying to throw out there the easiest way to say this. So we were paying about 47.5% last year. They're making sure that we don't pay a penny more than that this year. So basically, we're going to be, even though it's structured differently, they're going to make sure that the difference between what it takes to cover the new liability and what we paid last year is fully covered. And that's going to decrease by 10% every year for the next 6 years.
So our burden, our liability for the retirement system was, say, around $75 million, I believe was the number I had heard. So we're looking at basically what the state has done is take that and make it into a loan type structure where we're going to make a payment on that moving forward. So that difference that Ron is talking about and that number that you're seeing there is what the state is going to subsidize for us, they're going to allow us to have that money to help with that burden of the cost of that payment that we have to make. And it will go down. This was the 100%, like he said, but it will go down 90% the following year, 80% the following year, until it gets to 50%. And then it will maintain the 50% match until the loan is paid back, is my understanding. Now, you all understand that that is a legislative option, and every year the legislature has the choice to overturn that or do something different. So that's where it's going to be extremely important for health departments to continue to advocate for this funding. This is going to be crucial for us moving forward. So this 2.4 federal money here that you see, that was primarily COVID money that we have received over the course of the past year that we do not expect to receive moving forward. So that will be a loss for us. This local tax money here you'll see is $119,000. That's some increase in taxing property values and that kind of thing that we may be seeing this coming year. The school health contract, you all know that we no longer provide the school health services in our district. So that's just a legacy fund that's in there that no longer pertains to us. And then the others, some of these are small numbers and I won't go into each one line by line, but the big numbers you'll see there is that million again for hands. That's because like I said, we did not fully pull down all that money last year with COVID response. And we plan to access all of that this year. Also our clinic, we didn't get a lot of clinic services in this year. So we're looking to increase that again. Our insurance there, you see under insurance is $362,000. That is the Go365 revenues. That's the biometric screenings that the health department is able to offer for state employees who have the state insurance. And that is a little bit of a revenue generator for us that we're able to do, not just in our district, but we actually contract out with Lincoln Trail and Jefferson County also to do theirs. So that's the total revenue variance you'll see there of the 1.8 million. Then broken out a little bit here, you'll see some of the retirements that have taken place. That's going to save us a little bit of money because those positions are being replaced at a lower rate. So that's going to save some money there. Then that retirement money is also reflected here. You'll see that we now have that 1.8 million that's, promised to us that's going to help with that cost.
Yeah, so Amy, so the revenue they saw at the top is basically offset by the expense down here. So
Yes. So. Some of these differences, these numbers you'll see are differences in things. These are clinic services, a lot of them, and they may go up this year due to an increase in getting back to clinic services, us providing these services again. So there will be some there. I think on the next page also, there's you'll see travel is expected to increase. You all know, we've been Zooming and Skyping and all of those Microsoft meeting kind of things for the last year or so. And we do hope to get back to some travel, a little bit of out of state, possibly with some conferences and things, if that's all an option for us. The Ryan White program is mentioned down here at the bottom. That is our HIV program where we kind of case manage with our HIV patients across the region. And that is a reimbursement program for us. So we're out the money up front, but the federal government reimburses all of those costs to us at some point. Some of these supply costs, as I mentioned, will probably go up. Some will go down. We had a lot of computer costs and equipment, technology kinds of expenses with COVID last year, trying to get people access to remote work options when they had to be at home and they could still access their computers and work from home. Some telephone costs that went up due to increasing our line capacity and different things, with scheduling and a lot of the things we had to do with the vaccine. So some of that will have some variance here for this coming year. And it's the biologicals and the supply costs for the clinics. Those are the big expenses here that you're going to see. So getting back to family planning and some of the costs of the pharmaceuticals and the things for the clinics are included here in this budget. A lot of these are just small, in the scheme of things, small amounts that I won't necessarily get into, but if you all have any questions about this at any point, please, feel free to interject and stop. One of the bigger numbers here on this page is the staffing agency services. We did a lot of contract staff during COVID where we didn't necessarily bring them on with the health department benefits and things, but we contracted with temp agencies and things. And so since COVID is decreasing and our rates are going down and transmission is not as much, we are resizing those services and letting go some of our contract staff into the future. So those costs will go down. So that's the variance explanations for the expenses. You can see it's 1.9 there for expenses with the explanations. Next pages are just pictograms or pie charts here that you can see where the funding has come from. This is our revenues. The largest chunk here is state grant funding, then followed by federal grant funds, local tax dollars, and then the Medicaid money in the hands. When the health department district started, the core health block grant was huge, and that was one of our primary sources of funding. And you can see now that's less than 1%, barely over 0.5% of our budget now is through that funding. So state grants, federal grants, and local tax dollars are what's keeping us afloat right now. Mr. Crabtree, if you'll go to the next one, I think it's the expenditures, and you can see there that pie chart. The overwhelming majority of our expenses, 75%, actually more than 75%, are staff and salary costs. So this is leave, fringe, benefits, everything it takes to have an employee. It's an employee cost. There's very little that goes into travel or space or supplies or those types of things. Those are the areas where it's really easier, not that anything is easy, but easier to make cuts when there's deficits and things, those kinds of cost centers, those type of expenditures. And you'll see that we are already lean in those areas. And so the primary place where we have our biggest expenses are salary related. Now the following pages here are just basically different formats of showing you basically those same numbers broken out. This is by cost center. In the highlighted columns there will show you what we expect to receive. That first column is what we expect to receive for the upcoming fiscal year. And then the next column next to that is what the change would have been from the previous fiscal year. So the next few pages get into staffing. And this is some health department staff who we were reclassing or rehiring or that are retiring, changes in personnel basically that are going to affect the budget. So you can see here what those are. It's just a few. The next pages are every staff member that we have. This is their names and salaries and expected hours of service and all of that for the fiscal year. We always provide this to you just as transparency. That also includes, the last page there was our contract staff, people that may not work full-time, but that also just do part-time hours with us and that kind of thing. This sheet is more of our benefits package costs and everything here that you can see, the insurance costs and fringe benefits and retirement portions and all of that.
Hey, Amy.
Yes, sir.
Sean, can you go back up to that sheet? I do want to point out, not that many of you may care about this, but for years, this is where I was saying for years, our structure was to pay a percentage of every employee that was here of roughly about 47.5%. It was right here where it shows that 10% number now. That looks really nice because our retirement rate has now dropped from 47 to 10%, 10.10%, which is great. But this big ugly number to the right is what Amy was talking about, is the loan that we have to pay back now. So actually it's gone up But it has gone down by per employee, which allows us to hire back, which allows us a cheaper way for people to get back into the merit system, which is great. That's a good thing. But unfortunately, until we pay off this loan, we still have to pay huge retirement costs. So I wanted you to see how it's a different structure now. And if you go down there a little bit further, it shows how much actual money they're giving us under HB8 subsidy. So that's what I was talking about. If you go up just a little bit, Sean, the HB8 subsidy down here in blue is showing how much they're giving us back to help us with that. Of course, that'll decrease a little, 10% each year.
Thank you, Ron. So the next page there on the packet is our Go Hire employees and the breakdown of who they are and how that works. These are employees who, because of this subsidy that the state is now offering for retirement, we are working diligently to get them moved back over into the merit system, or hire them under contracts or bring them back under health department and no longer use these contract services with these agencies. So that was part of the requirements in order to receive the subsidies and the state money, is that we have to restructure that and get them out of those temporary agencies and be paying the benefits for those employees through those agencies. They need to be employees of the health department and contributing to the retirement system in some way. So that's where they're going, and that's what we're working on now. I'm sure Carol will talk about more of that in the human resources report she's got too. So these next pages are just very detailed general ledger accounting type sheets of all of our expenses and analysis of these budget numbers that we've already talked about. If you're interested in how things break down more specifically, you are more than welcome to look into this and let me know if you have any questions. I'm going to go over to the next page, page 27, if you could, Mr. Crabtree, right here, and talk about, this is by department. You can see, so environmental, where their funding comes from, how much funding they're receiving, those kinds of things. So this is a useful sheet for me and for the department heads to look at and kind of see where your funding is coming from and how that's structured and broken out. And the next pages are just more of the same type of budget analysis and numbers that really the department heads and the finance team and everybody looks at monthly. I will say the last few pages there, page 34 to the end, are local health priorities. These are programs that the health department has chosen to work on at this point in time because we have money to fund them. And so these are things that at some point in time, if we got into a pinch, I guess we could discontinue these in a more convenient manner. And so we are the state is starting to require us to submit this kind of information to them so that they would know, I guess, quick fixes of how to get us back in line with our budget if the need arose. So overall, if you'll just bear with me, I'll summarize one more time this budget. We're looking at a total receipt for the upcoming year of $17,478,000. A total expenditure for next year expected to be $15,940,000, leaving us an anticipated surplus next year of $1.5 million. And that's with the big payment toward the retirement. That's with the state coming in. That's with us losing the COVID funding. Some of those things are already factored in to this. And that is also, those numbers also include, as I said, a 5% increment should you choose to do that for LCDHD staff. So I will be quiet for a moment and you all can discuss and take your time and ask any questions you have.
Anybody have questions about our budget? I was going to see if any way we could get a 10% increment for the board members. Can we ask that?
Well, you can get 100%.
Yeah. 10% of nothing is nothing, right?
That's right.
It's a good budget. We actually met with the budget committee a couple weeks ago and looked through this, pretty in depth and think we're on solid ground, even though it was a skewed year due to COVID. We think that we're still on solid ground and looking good going forward. We do have the retirement issue looming out in the future, but I think we're ready to handle it as well as any health district is. So I don't know if you've got any questions. Now's the time. If we'll give you a few moments here, and if not, we'll ask for a motion to approve this.
Judge, I think since it comes out of subcommittee, it'll come out as a motion in a second, and you'll be ready to go straight to discussion.
So run that by me again. Do I need a motion and a second?
I think when it comes out of a designated subcommittee, whatever you all recommend comes to the board as a motion in a second. You go straight to discussion. I think that's right.
We did vote on this as a subcommittee, and we did approve this. So it will come to the board now. So it's open for discussion before we take a vote. Hearing no questions, we'll go ahead and call for a vote. All in favor of approving this budget as presented, please say aye.
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 And likewise, if there's any opposed, please indicate by saying nay. Okay, well, the budget passes. Thank you, Sean and Amy and Ron, for your hard work on it, and also for the budget committee that met and went through this with them. All right.
Thank you, Judge.
Okay, next item on the agenda then will be the grants report. Carol, you have that for us?
Okay, so we have applied for and received no-cost extensions. Lake Cumberland District Health Department was given an additional year to provide programs and spend previously awarded funding that wasn't spent due to COVID. We had suspended a lot of our grant programs during COVID, and as you've been told before, we've shifted staff to do other things. So the grant monies just kind of sat there. So we have asked for an extension in the health education teen pregnancy program, the Heart for Change program that from the diabetes program, and then the CARES program, which is ROPA JEP, the gel education program. So all of those have been approved and extended for one more year. We'll continue the programs and be able to pull down the remaining funds. We applied for and received a $25,000 grant from Enviro Health Link to promote COVID-19 vaccinations among hard to reach populations. And we're working with a local marketing company to implement that program. And then we are looking at a sexually, the SRAE grant that Tracy has had previously in the health education program has been released again, and we're looking at that, and it's due July 15th. So I expect that we will apply for that one, that funding again. That's all I have for the grants.
Okay, thank you. Next, then we'll go into our continuous improvement, and I guess, let's see, Amy, do you have something there, or do we need to move on to Carol again for new employee orientation?
I just want to remind everyone, Judge, on the back of the agenda, which is in your all's documents now, I guess your packet, so you don't have a physical one of these, but there's a reminder that you can always write down suggestions. When we meet in person, it's a little easier. You have this in front of you and you can just jot down thoughts or comments or whatever and hand them to the director, to me, to a staff member, whatever, and make sure that we are addressing those. You all always have access to me by email or phone or text or anything like that. If you have concerns or issues or things that you want to see addressed, just suggestions for the agency or whatever, please feel free to reach out and let me know what your concerns are, and I will do my very best to address those for you.
Okay. And then we'll move on to new employee orientation with Carol.
All right. So as we've discussed before, we have tested our processes and we've moved through the phase of doing a more virtual new employee orientation from their home location and having the supervisor assist them with logging into their computers for the first time. We've done that with contact tracers when we brought them in over this past year, and that seems to be working out well. So we're going to continue that process whenever we have just a few employees coming on. We're getting ready to bring in our Go Hire employees, and we're going to do that face to face due to the large amount of those people of staff who are transitioning to Merit. But for the most part, we're going to continue on with the remote orientation. And then the employee harassment training, we have put that on hold until hopefully we'll have something started again before the end of the year.
Is that all you have there? And as far as employment harassment training as well, you have something there?
Yeah, we're that's on hold for now.
Okay. All right. Next
Kelly,
then will be our partner.
Before you move on, Judge, if you don't mind,
Yes.
I put my name and email and phone number in the chat too, just in case anyone didn't have a way to contact me. I think I've heard from most of you all and talked to you all enough that you should have my contact information, but just in case anyone did not, that's there for you all too, and just feel free to reach out to me.
Okay. Thank you for that. Move on then to our partner engagement. We have our syringe exchange progress update with Tracy.
Tracy was not able to join tonight, I think. Laura, do you have something for that from her? Did she ask you to participate, or do I need to do that? I have a statement, I think, from her.
She said she had sent you some information.
Okay.
I have the numbers if you want me to read those by county of their participants. If
Okay.
I can be pulling those up while if you don't mind, and I'll
Okay.
pull those up.
Thank you. And I'm sorry to put you on the spot. I just didn't know what
No,
the
it's
final
fine.
arrangements were.
Yeah.
The things that Tracy told me about the syringe exchange progress and the update is that we're working on Cumberland County, I think. Judge Phelps, is that still where we're at? They're still doing education and working on some things there in your county before we go for any sort of vote or anything. I think
No change right now.
Okay.
We've had so much going on with flood damage that nobody's even had on their mind, to be honest.
I understand. We've all had a lot on our plate, and you all certainly with the rains and everything you've had to deal with. So we will get back on track with that. I think that was our next effort. Was she was working with Cumberland County on whatever possibility for the future. So, Laura, have you had time to find numbers? I'm sorry.
Yeah. Yes.
Okay.
For, of course, the UK staff that was hired primarily works those programs. So we rely on them to get give us numbers and give us progress reports, which we're very pleased to have that staff in our buildings. That helps us with cost, and they provide much of our supplies as well. For the May report, Russell County had 236 participants. They dispensed also 62 doses of Narcan. Pulaski County had 352 participants. 77 Narcan doses were given out in Pulaski. Taylor had 233 with 62 naloxone given. Adair only had 11, and they dispensed 6 doses of Narcan. And McCreary had 294 with 119 naloxone or Narcan given.
I'll add to that in case any of y'all, we update our syringe exchange information on our website under our substance abuse programs. Y'all can look at that and see we do recollect the syringes we hand out. So you can see that on our website too. That's for you guys and for the public.
Is that everything there with the program we discuss?
Don, what's our current return rate?
Let me see if I can pull that up for you.
I'm sorry, I got lazy and didn't look it up myself.
Give me just a second. I'm going to the website. All right. So share. Okay, so this is on our, again, this is on our website. The number you want to look at is for our return clients. So this is our, you can see our collection rate right now is 96%. It'll never be quite 100% because sometimes people only come once and don't come back. Well, these are repeat visits, but sometimes you know, if someone doesn't bring their needles back, we give them one chance. And then the second time they don't bring their needles back, we ask them not to come back to the program because it's really important we recollect those needles. We don't want them ending up in the parks and ditches and sidewalks. You all may see needles in the parks and sidewalks and stuff, but it's not ours because we're doing a really good job of recollecting what we hand out. So right now, overall, it's 96% recollection rate. There's a lot of other statistics on here that you all can look at too. Again, that's on our website. So, and if this is updated through April, we'll update it the May number shortly.
All right. If there's nothing else there, we'll move on to oversight and let Amy talk about our COVID-19 update.
I am hopeful that we will not be having to put this item on the agenda for that much longer. We're all kind of talked out about COVID and tired of this, but we are to the point now in our response where we have deactivated our Department Operations Center. We are at our lowest level, which is monitoring and surveillance. We're really just, it's pretty much the preparedness position, which is still me for the moment. I'm doing executive director and preparedness for the district until we get the other position hired. So it's me and Amanda, who is our epidemiologist, and we are monitoring and checking out the numbers. And that doesn't necessarily mean we're the only two people working on COVID in the district. That's certainly not the case. But that's the ones that are tasked primarily with, tracking the numbers and that kind of thing. We are still very active with vaccination efforts and planning. We have a mobile van that you all may have seen pictures of or seen out in action in your communities that's getting out into the counties. We are scheduling things at county fairs and at food banks and distributions, churches, just anywhere and everywhere that we can go and set up and do vaccinations that they'll invite us and allow us to come. The vaccination rates across our district are lower than the state average in every county. We don't have a single county, I think, in our 10 that are above state average for vaccinations, but we are continuing our efforts, and so are our partners. I know all of our community partners and providers and pharmacies and everyone who's working so hard to get this out. They are still continuing, and whether or not it's 1 or 2 a day or 15 a day or whatever the number is, that's that many more people that are going to have protection. So we are continuing those efforts as we move forward. That's where we're at. The mask mandate, I will say the mask mandate has ended. Pretty much all of the capacity restrictions and everything has been lifted across the state. So it truly is at this point on each individual citizen to protect themselves and take the necessary precautions to do what's right and to do what they feel comfortable with.
Amy, may I add one thing?
Absolutely, sir.
Yeah. So of all of our cases, only 0.5% have been reinfections. And since the vaccine has been becoming available, right at 98% of our new cases have been people that haven't had any doses of the vaccine. So it's clear the vaccine works really well, and almost all of our new cases are people that didn't have any doses. And we still know that 1 in 50 are going to die from it, and 1 in 18 is going to end up in the hospital. So we can prevent death and hospitalization by getting vaccinated. Our citizens can, and hopefully they will. But one way or the other, at least it is trending down at the world level, at the national level, at the state level, at the district level, and at the local level. We're very pleased with that.
And another point about COVID before we move on is that the vaccines so far seem very responsive to all these variants that you may be hearing about, the Delta and all these other types of things that are popping up, mutations in the virus. The vaccines still seem to be effective against those. So that's good news, moving forward.
Great. All right. Any questions about that from anybody? If not, we'll move on to the Human Resources Report with Carol.
Since our last meeting, we have had 6 come on duty and 37 go off duty. The majority of the ones that are off duty were contact tracers, disease investigators. So those were our temporary staff that was hired through Crown Services. And due to House Bill 8, currently right now we are offboarding 17 go hire staff, and we anticipate onboarding approximately 20 on June 28th. So we're going to be doing orientation for 20 new merit or contract full-time staff on June 28th. And then still have 2 vacant positions that weren't filled for this week or for this orientation that will be reposted or oriented at a later time. And that's all I have.
Okay, thank you. Next then, we'll go to our policy development. We've got any new policies with Janae, if you'd like to report.
We did have one policy revision in the diabetes program. We emailed that out and it's also in your packet with the changes marked there. So we just need ratification on that policy this time.
Okay, do we, you kind of cut out there. We don't need a motion to approve that, do we?
Yes, Judge, you will.
Yes, we do.
Okay.
Don't move.
Second.
That was Jim Wesley and Dr. Watkins.
Okay,
Yes.
we have a motion and a second. Is there any further discussion? All in favor?
Aye.
Any opposed? All right, that motion carries. All right, well, we've folks, we've got to make a decision here, and we've been doing Zoom meetings for about a year now, and we're able to reconvene at face-to-face meetings, and we were talking about this a few minutes before our meeting started. I don't know what the consensus of the group is, but maybe maybe we ought to go ahead and schedule one in-person meeting and discuss at that point whether we want to stay with Zoom or if we want to stay with in-person, or maybe we go to one a year in person and the rest Zoom. I know it's for me it's more convenient to do Zoom than it is to drive out of town, but I do enjoy the fellowship and I do enjoy the good meals. But I think we should probably try to come back together as a group face to face at least once, and then decide from there going forward what our consensus of the group would be.
I agree with you, Judge.
I agree with that.
So we've not seen each other in a year. I'd like to see how much weight y'all have gained.
How much hair I've lost.
If y'all got the COVID-19 on. So what would our next meeting date be then? Does anybody have that calendar handy?
I looked that up, Judge, and it would be September 7th. That would be the first Tuesday of that next quarter.
Let's go ahead, as your chair, I'll go ahead and make that decision that we will reconvene in person on September 7th. And then at that meeting, maybe we can put it on the agenda to take a consensus vote to see how people would like to go forward with that.
I will seek also, I'll seek clarification from the state on if there's any kind of restrictions on anything at that point in person, or if the board is required to do so many in person, what the logistics of that's going to look like. And I'll try to have information for you. And if there's anything that says that we should not get together, if the numbers increase or we can't get together in September, I'll set up a Zoom link and we'll continue as we have been, if that's everyone's pleasure.
That'll be at the Russell County Health Department, right?
That is correct. All right, so that's that's all the business we have. If there's nothing else from the board there, we would entertain a motion to adjourn.
So moved.
Second.
We have a motion second. Any further discussion? All in favor?
Good night.